Well, experts, they are expecting a tough allergy season in the Hudson Valley.
And in this week's Raising Our Kids, our Christa Lauri talks to an allergist about the best treatments.
Well, this is prime time for tree pollen allergies, but while it can be rough for adults, it's even worse for children. And after the long winter, we had no parent wants to keep their kids cooped up inside. Joining me now is allergist Dr. Laura Mechanic of Westmed Medical Group with various locations in Westchester to talk treatment. Thanks so much for being with us, Dr. Mechanic.
Thanks for having me.
We have been talking about it being a rough allergy season in front of us here after a late warm-up. How bad will it be, especially for kids with tree pollen allergies? My youngest, who's 6, she gets the puffy eyes each season. So, you know, we've lived through it, and it can be hard.
It definitely can. This is prime season for tree pollen. With the later lasting cold weather that we had, if it's a drier spring, it's going to just explode with tree pollen. If we have a wetter spring, it may not be as bad. But a few weeks ago, we did have that warmer weather, and the tree pollen levels were mid-range and did start.
And you're seeing a lot of people already, I'm sure, in your offices with their kids.
Yes.
Can I ask you, when do you start to recommend allergy shots? It is an investment of time. Of course, no one really wants to give their little kids shots.
Right.
And it may not always be necessary. So tell me how you proceed with that.
Okay. Usually we start, especially in children, with trying some medications. Usually first line would be an over-the-counter antihistamine, which for many can be very, very helpful and enough.
Right.
But if a child doesn't do well with medications or has symptoms at other times of the year as well, that may be the time to start thinking about allergy shots, which basically involve giving the child increasing doses of the allergens that they are allergic to, and then over time they develop a tolerance to these,
immunity, if you will.
things. Yes, but it is time consuming.
Dr. Laura Mechanic of Westmed Medical Group, we really appreciate your time.
Thank you.